Good afternoon, everyone. Thank you very much for taking the time to join us this morning, this afternoon. I hope you were able to take a moment to skim through the adopted AAP guideline for the COVID situation that was sent, I think, on Friday. If you didn't have a chance to look at it, obviously, the purpose of today's webinar is to go over that guidance and really have help you understand what this adaptation is all about. As you know, the M&E team has been working with all of you, all country offices, to operationalize our AAP framework and then in most, if not all of the country offices, we provided training on AAP, assessed current AAP practices. We developed action plans together to either improve existing mechanisms or develop new ones. I'm happy to say that almost in all of our country offices practice one or more AAP mechanisms for all the programs, for our programs. But we also had a more detailed guidance with that we shared I believe a couple of months ago to get your feedback. Thank you again for the feedback that you gave us at the time. As we were incorporating the feedback to finalize that guidance, the COVID hit and we had to kind of pause on that longer guidance and work on adaptation of the guidance for the current situation, as we did for all program adaptations that were led by our technical directors. So today, the purpose of this webinar is to go over these adapted guidance, and the session has 3 parts. Part 1 talks about why AAP is important, what are the mechanisms that are appropriate in the current situation, and how we adapted them or we need to adapt them in the current situation. How AAP, so the second part is the AAP in the context of our signature approaches. This is to look at some examples how we should address AAP issues in the context of our signature approaches, and this will be addressed by our technical directors. Part 3 is focused on prevention of sexual exploitation and abuse. We needed to have a spotlight on that because that is a very critical issue, especially in time of crisis. So we should be able to probably have gone through these over the next 30 minutes so that we have enough time for questions and answers. So I will hand it over to you, Natalie, to take us through the presentation and manage that afterwards with the rest of the team.
Sounds good. Okay, everybody. Thanks, Mulu, for giving that framing and introduction, and thanks everybody for calling in. So going through this agenda, recognizing that we've talked with almost everyone on this call in some way or another about the practice of accountability to affected populations. So when we talk about adapting this for the COVID-19 situation, we're really building on a lot of the work that we've been doing and that you've been doing in your teams to enact accountability already in programming. What we're going to do here is really locate it in the COVID-19 crisis context and kind of review some key principles and think about the shifts that we will make to adapt the mechanisms. We'll briefly touch on kind of AAP and highest policies, and then we'll also talk a bit about feedback and information flows. And then from there, we'll go into specific program examples for each program approach. So this is the framing section, really. Just to refresh everyone's memory on the key pillars of AAP and why they matter even more, or matter just so critically in the context of a crisis. So the principles that we operationalize are regular, timely, and accessible information sharing. And this is information sharing as a two-way flow, both to affected populations and back from affected populations. This is especially critical in a crisis and in a crisis like COVID-19, where we may not have our regular channels of communication with the populations that we're serving. You know, we may have remote channels of communication, but ways of sharing information that we're used to or that populations are used to may not be as feasible. Often the crisis context moves really quickly. Highest services are changing and adapting and shifting. The context itself is shifting. And so it's critical that populations understand what they can expect from highest services, what we are able to offer, what those look like, and also all of the other mechanisms around AAP. So it's critical that that information stays up to date as the context is really shifting. AAP, accountability as a practice, and thinking about the way that it is formalized and discussed really comes from emergency settings where we are, more likely to have limited access to a population and maybe limited feedback and higher protection risk across the board. And so this is kind of no exception. This is really actually digging into the heart of what accountability looks like. The same is true for participation and inclusion, especially with COVID-19, as we are not seeing people physically come to offices or physically gather in focus groups. We need to think even more carefully about what it means to ensure that everybody in a community can participate, everyone is included, not only in program design, but then in implementation and feedback, and should we ever get to that stage, program closeout. The same is true of feedback. We really, more than ever, want to ensure that feedback is flowing very, very clearly from all of the populations that we serve in a quickly changing crisis context. We want to make sure that the mechanisms that people access to give us feedback are still safe and accessible to everyone, and that we are acting on and really including the feedback that we get in this context. And then finally, our principle of learning and adapting, where we normally are bringing AAP information into the normal program cycle, both for program management and later program design. That's still true here. It's just that program management we may be making quicker decisions about program management than we may be used to. Or we might be working on program design or response design a little bit outside of the normal proposal cycle, as we see these kind of rapid fire or very quick COVID-19 responses that we are assembling in some places. So this is just to say, all of those principles are still more than ever, apply to our practice of AAP. It's that we really want to think about how our practices around accountability adapt to fit the context in which we find ourselves. So if we just skip to the next slide here, this breakdown is also found in the guidance documents that we've shared in English, French, and Spanish. They're as attachments for this invite. They're also on HighestNet, and Laura will send the links for those around again as a follow-up. But this is to quickly summarize what's in that document in case we haven't, in case anyone hasn't really had a chance to think through that, and to spark some discussion around that piece. So I'm going to go through these, but also leave a little room for some reactions and examples from country offices. So in terms of information sharing, the things that we think about that have really changed in this context or may change, we really need to think about how the mechanisms that previously existed to COVID-19, how do they exist in the current situation? Are those mechanisms still working? Are they still safe ways to share information to and from affected communities? As well as thinking about how do we use our information sharing mechanisms to get out information on COVID-19 risk reduction and safe practices and available highest services in terms of the crisis. I'm wondering, would anyone like to chat in the chat box or shout out to the group some examples of how they've been sharing information at this time? I'll pause there and check the chat. That's great. Israel already on it. Sivan is saying WhatsApp. And I know that WhatsApp is a common mechanism probably in a lot of locations. There are WhatsApp groups. Panama is also saying WhatsApp. You know, there are WhatsApp groups for target populations, for clients and beneficiaries, and thinking about how to leverage those is really. I'm also seeing text messages from Kenya, text messages, Instagram from Panama. That's great. Social media from Ecuador, phone calls. So I think a trend that we're seeing, oh, that's great. Aruba is saying Facebook, webinars, and radio. So I think a trend that we're seeing is, you know, a lot of our information sharing is now shifting to these remote channels of communication. And these are channels that, you know, hopefully were set up or existing before COVID-19 came into existence. Something that we really want to think about is who is able to access those channels, who are those channels reaching, both as the structure, kind of social and economic structures may change in response to the current crisis, and as people's access to technology may be shifting as well. That's great, seeing more on WhatsApp from Chad, SMS from, I think it's Kenya. So again, across the board, using those remote channels to share information and thinking about the information that can be pushed out and received from those channels. Something that segues into the next principle, though, to think about is who can access those channels and how does the COVID-19 situation actually affect or increase any vulnerabilities and any protection risks for individuals who may have been at risk before or who may be newly at risk. So this is applicable for thinking about who can access information, but then also thinking about who can access services. There's a good question I want to catch from Austria in the chat. Are people using personal phones or office issued phones? That's a great question. I think I'm seeing, and I think we're kind of seeing office issued across the board, across the chat. I'm seeing that across most of LAC, across Kenya. Yeah, across Greece as well. So that's really helpful and something to think about as well, is the way that information is handled and protected, so that we are not transmitting sensitive information about clients or personally identifying information across channels that are not protected or not on an official highest channel. That may be something we come back to as a specific point of guidance and work with country offices on as well. So then to come back to the idea of participation and inclusion, it's really thinking about whose access is shifting, who is included, who is not included, who is at greater risk for not being included, both in information and services and feedback mechanisms during the crisis. So can anyone share an example of how they've ensured inclusion of more vulnerable populations as the crisis has evolved? Yeah, for example, how do we make sure that we're catching, let's say, you know, women at risk and girls who might not have greater access to technology within their homes on those WhatsApp chats?
Hi, Natalie. It's
Hi.
Roberto. Hi, good morning for everyone. This is Roberto from Panama. Well, in our case, it's true. I mean, there are some cases that we have identified of women who are not related to social media, including WhatsApp. They are more paper-based or phone-based. So those cases, we try to reach them through a call, normal, regular call, to check in how they are doing. And also what we want them to know is that they should feel free if they are facing any critical situation at home, now that we are all staying at home, trying to know which lines they can contact, because most of the, let's say, emergency lines could be through WhatsApp or through a online system. but for sure there are regular calls that they can do to reach out security and protection from local authorities in case there's a domestic violence situation at home. So we are making sure of that. And so, yes, going old school.
Thanks, Roberto. That's really helpful. I think that brings up a great point for everyone as well around thinking about access to the emergency referral procedures or the referral procedures that might exist as well. How access to that may be shifting or changing for certain populations. I'm also seeing in the chat some good information, I think it's from Kenya and Israel, around, in both those contexts, reaching out to the community and ensuring that we are tied in to community outreach workers or community leaders or protection monitors, so voices coming from the community to really let us know what is happening within the community. And that's great. I think as a mechanism, it's so important to lean on those existing relationships with the community. It's also really important to recognize that we need to triangulate that information. So if we are hearing from community leaders, they may not always capture everyone's voice in the community. And thinking about how do we balance and triangulate what we hear from certain individuals with the voices of others who may not be as represented. So that's an excellent and really valid way, just thinking about that as one of multiple channels. Another example coming up, this is great, from Kenya, talking about reaching out to the elderly and people with disabilities through regular phone calls to make sure that they have the right information. And so that's a good recognition of the fact that, you know, we may not be hearing as proactively from some people who are very vulnerable. So we need to be reaching out proactively to those populations to make sure that they are included and they're up to date. So that's great. This is starting to get into the area of feedback. So moving to seeking feedback and what we do with that feedback. Really for crisis context, this is really, really critical because feedback may range in content and in seriousness, from simple feedback about a program or activity, all the way to a really serious complaint, which could include sexual exploitation or abuse, which we abbreviate as SEA, or a breach of the code of conduct under which SEA falls, but other breaches such as fraud. So we'll get into a little bit about the serious complaints a little later in these slides, but just for this slide, to think about all of the feedback that we may be receiving at this time, how we ensure that we're seeking it proactively, and then we're actually using that for program adaptations. So two components here, both how feedback is informing the way that our programs are shifting and adjusting, as well as making sure that the mechanisms for receiving feedback are still accessible and safe and confidential, especially because we know that with kind of the crisis context, protection risks go up. It is possible that we may hear about or receive some more serious feedback in this context. So could anyone share some examples of how they have been seeking feedback and or acting on feedback received at this time? I'll mute myself again. And if not on this one, this is one that we'll delve into a bit through the following slides so we can continue to talk about it at that point. I think then I'll just go to the last point, which segues again from feedback. So the learning and the adaptation. So we want to make sure that we're proactively collecting the feedback, that the mechanisms for the feedback are accessible and safe. We also need to make sure that we are responsible and accountable for what we do with that feedback. That means making sure that even in this context, even as things are shifting and changing, we are reviewing feedback on a regular basis. We're not just seeing feedback as a one and done exercise with communities. It's that there is a continual and regular flow of feedback coming into your office or your team and that it's getting reviewed on a continual basis to make sure that we are really in touch and kind of up to the moment with what is happening in communities. And then to make sure that it is being fed back into programming. That may be program management on a weekly basis, to sit down with your team and review feedback and make sure that the ways of giving programming are still working on a very local level. That may also be keeping in very close touch with the teams who are responsible for that feedback and these adaptations, really flowing into new program design, whether that's program adaptations for existing work or program design for proposals or kind of any response work that is kind of new and coming up because of this crisis. So I think I'll leave this piece there because we'll continue to talk about this as we go through the slides, but really framing for everyone, as we think about AAP in the COVID context, it's how do we adapt our current mechanisms? How do we rely as much as possible on what we're doing, but make sure that it's adapted? And then from there, adding new mechanisms as appropriate. And then really thinking about how do we prioritize the key elements during crisis, and information sharing, receiving feedback, making sure that people are included as the context is shifting are very key, and especially key in emergencies. So let's look a little bit misaligned. Just to quickly touch on a couple aspects here, we're going to come back to the idea of PSEA and our responsibility toward that concept a little bit at the end of this presentation. I want to just acknowledge that is a much, much larger topic. It's something that deserves some sessions of its own. So we are not saying in any way that this is the comprehensive, a comprehensive take on it here, but I do want to just structurally locate AAP within some of the existing highest policies. So AAP is a much broader umbrella or framework for how we talk about our accountability to affected populations. Within that accountability, we want to be clear that when serious complaints come up or when serious violations come up, HIAS does have specific policies around preventing sexual exploitation and abuse and around safeguarding for children. There are standard operating procedures around that are, I believe, kind of forthcoming from HIAS HQ right now. And it's all aligned with the way that the HIAS Code of Conduct actually sets up standards. So just to locate this structurally, AAP is not quite the same as either PSEA or safeguarding. Rather, AAP may reveal instances where the PSEA or safeguarding policies and procedures apply. So we'll get into that a little bit more at the end, but for the sake of time, just to kind of jump past that piece. Finally, this is a familiar slide or a familiar flow to everyone, just thinking about the way that feedback is actually handled in a crisis context. So minor requests for feedback really being circulated through a field level or country level, making sure that we always close the loop with the person who is giving feedback or giving a complaint. And then more major dissatisfaction or issues being really escalated to the appropriate level with a program manager or country director. And then finally, serious issues, which would include a breach of the Code of Conduct or PSEA, going through the dedicated process for reporting serious complaints. So this is really just building on the existing flow of information, but making sure that in a crisis context, we are even more cognizant than usual of understanding that we provide the safe mechanisms for this feedback to come back to us and closing the loop with people or communities who are providing feedback. And then finally, before we really get into the discussion of AAP with our signature approaches, just to recognize that AAP is cross-cutting. It is often, it's not just one program or another. So we're going to present some examples and kind of work through AAP questions that service providers and that country teams might face, but to recognize the real interconnection between all program areas and between really all roles on a country team in practicing AAP. AAP is something that everyone has a role in, from the country director to the M&E staff, to the program managers, to the community workers. And so it's a cross-cutting and integrated topic, even though we're going to ask you to work through some kind of specific examples with each program area. So I'm going to, oops, oh, you know what, I'm just going to go over this chart quickly and then hand it over to the technical directors. So this is just locating AAP within the program cycle. And rather than reading everything on this chart, I think I will just highlight here that, you know, this again reinforces AAP touches everyone's role and every piece of programming. There is the planning portion, there is the program design portion, implementation, and M&E, all in a cycle with each other. As we get information from our practice of AAP, it should be feeding into our planning, feeding into our design, which then in turn feed back into our implementation, you know, our real-time feedback and complaints and information provision. And then the M&E function continuing to kind of monitor, seek the feedback, make sure that the feedback is being acted upon and fed right back into that planning process. So all of the AAP mechanisms are meant to feed all parts of this cycle. Okay, and then finally, just thinking through a couple questions here as we think through our signature approach examples. So making sure that as we get feedback, our mode of implementation is relevant and effective for communities, anticipating where complaints may come up and how we should respond to complaints, making sure that we're sharing the right information about services, about the context, about risks, and then as always, making sure that we're really closing the loop with the feedback provider. So keeping this slide in mind, and I know we've gone over it really quickly, but keeping these aspects in mind, let's work through some kind of specific examples from each program area with what we might do with AAP information or our practice of AAP in the current context. So I will mute myself for a second. I'm going to turn it over to Annie to talk through and work through what happens in this MHPSS scenario. And I'll give everyone a moment to read that.
Thanks, Natalie. I think I'll read it out loud too, just for people as they're reading. Hi, everyone. So this scenario is a counseling psychologist or other MHPSS team member becomes aware that a HIAS community worker who has worked with HIAS for years is only referring vulnerable clients from one particular area of the city for follow-up. So in reflection of some of the points that Natalie just shared, and in thinking through what we've already heard from this presentation, what are some of the things or some of the responses that you think the counseling psychologist should have, or some of the actions for the counseling psychologist to do? If you want to take a moment to think about this and then respond in the chat box. I believe if you want to speak, I think that's okay. We have quite a few people on. So maybe let's start with the chat and see if anyone has thoughts or responses to this scenario. And other TDs or Natalie, feel free to jump in as well.
Thanks, Annie, and I'll watch the chat box too.
So I see one response: document the observation in writing to the country director. Thanks, Emily. Discuss with community worker to understand why. Have a word with the community worker and remind them of their obligation. So those are a great start to some actions and thoughts in response to this scenario. Natalie, do you want to add anything specifically in response to this scenario?
Sure. I think something interesting we're seeing in the responses so far, the running theme is thinking about the coordination between some of the roles. So a piece of it is understanding what's happening with the community worker and making sure that this is kind of taken up the chain or escalated as needed to the country director. But another piece is the content here, which is thinking about the principle that everyone should be included in highest services. Oh, and I actually just saw that come through on the chat from Kenya. So reminding everyone that highest services are rendered without discrimination. And so that is the AAP piece or the principle that I think we would want to highlight here.
I think, and this is Mulu. I think what I know Kiprano raised the issue here. The issue here is that there is discrimination that's going on or favoritism that's going on. And what we would like to really amplify here is that in our orientation of all staff, what our accountability to affect the affected population means that the key principles of inclusion, as Natalie, you pointed out, and that non-discriminatory service provision has to be highlighted, and every program per service provider should be aware that when they sign up to work with HIAS, whether it is our own staff or a community worker, they understand that, and that's part of our job of training our staff or associated personnel with HIAS what accountable programming means. Over to you, Natalie.
Thanks. And one really interesting thing that just came through from Caroline in Kenya, the importance of triangulating that information, right? So that's really helpful, saying it's important to find out what's going on by talking to others in the community, such as the community leaders and the other office staff. And that's such a key principle to follow in general whenever we are speaking with representatives from the community or the population, is making sure that we are always kind of triangulating the information and we are not just kind of taking or prioritizing one voice. And so that's a piece also of upholding the anti-discrimination piece of AAP. And then from Emily from the RSC also pointed out it could be a pattern that needs to be coordinated through the CD and may have been observed by others, which both also, it gets to both the triangulation of checking, but also the potential need for escalation of the issue. Muted myself. I'll take us to the next one, which is a GBV scenario. And I don't know, Heidi or Emma, if you're on the call, would you like to talk everyone through this?
Yeah, Emma, I'll go. A GBV case manager hears from a client, a woman, that the client's husband, who is the perpetrator, demands that she put the phone on speaker whenever she's talking to her highest case manager so that he can listen to the conversation. The question is, when you think about the guidance of our AAP work, how would you handle this situation? And similar to Annie, let's start with some thoughts in the chat and go from there. Siobhan, I see you suggest some alternative methods of communication, maybe? Other thoughts? feel free to let fly. Happy to talk through anything, any and all responses.
Emily is highlighting the need for a home visit.
Okay. And when I see use a community outreach worker, would that also be for a home visit as well? Are you suggesting, is that a suggestion of the home visit? Okay. All right. So I see I here, Natalie, one of the things I'm seeing that I think fits very squarely within the accountability of affected populations framework is listening to the feedback that's being given. And the feedback that's being given is, when you call me, I am not going to have a choice but to have the phone on speaker, right? And it sounds like all of the responses respect, immediately respect that. And so I think that's the priority, right? When we hear something like this, the client is in a situation where it's clear she doesn't necessarily control the phone. And if you are calling when her husband is in the house, it will have to be on speaker, right? During this time of COVID, there is a very good chance the husband is going to be in the house, right? So you will have to look at either being very limited in the conversation, right? And being very safe in the conversation, or trying to figure out ways to agree to alternative communication. Emily, in terms of not only in this moment, but outside of COVID, home visits within certain parameters would be an option, because we know that domestic violence is happening in this situation. A home visit should not be done alone. You would have two of you. That's going a little bit outside of the scope of AAP. I think that this is, and then Sylvia here is, we have a color code so the client can tell us if they're in danger. So everything that I'm hearing is that folks are picking up that we have to listen to the client, and we have to figure out contextually what is going to be the best option for safely communicating with her.
Yeah, that's great. Thank you, Heidi. I think we're really seeing that teams are paying attention to the context in which clients are finding themselves, especially in COVID, and recognizing that maybe sometimes the normal means of communication, of remote communication, may not be safe or okay for some women and girls at risk. And that's something that's kind of heightened right now when we don't have as much, we don't have alternate ways of access. And so to be very, very aware of that as we also think about how to not cause a further safety issue or complicate a safety issue. Anything else on this one? I know it's such a quick dip into a very complex issue, but anything else before we go to the next one? Okay, I think a lot of this is great, like what's coming through in the chat. All of these specific details are getting captured in the chat and in a recording of this meeting. So there are some specifics and some further follow-up that we can do on this one particularly. Okay, EI and CBI, and you'll notice here that there is really a cross-cutting nature. There's been a cross-cutting nature across all of these, but it comes out here and reveals some complexities. Gala, would you like to talk everyone through this one?
Yes, thank you, Natalie. Good morning, everyone. And good afternoon also. So for this scenario of economic inclusion and CBI, we have the following: a highest client share with the CBI project officer that one of the community leaders in charge of the cash disbursement in the community is misusing funds. She reported that the community leader is giving the money to his relatives only, and that the community leader asked one of her cousins for a sexual favor in exchange for the money. What should the project officer do? I would like also to hear your thoughts in the chat first.
I'll bite with a leading question here. What about the fact? Oh, nope. Someone has. Yes.
So Elena said that to inform the country director in writing and possibly also highest ethics points. Gray said call a few clients to verify the information given. And Emily also said this is fraud and violation of PSEA. It should be reported to the country director for follow-up. Masai said the report could be forwarded to the anti-fraud focal person and the country director for further investigations. And Sylvia said, register the complaint report and investigate with the community leaders and beneficiaries. During the investigation, the community leader has to be separated from the project. Okay, Maria Jose said from Ecuador, a remote post-distribution monitoring could also shed light on the misuse of CBI funds. So it seems that there are many ways of handling the situation, but the common voice here is that a country director should be immediately informed about a situation, especially because it's a very difficult situation that it's described, and it should be handled very in a very delicate way, because we are not just talking about misuse of funding. It's also we're also talking about a sexual favor in exchange for money in the project. So it is a very delicate case.
Thanks, Gala. I think, yeah, it's really interesting to see a couple threads running through this here. I mean, one is the recognition from everyone that there's a reporting burden here, right? There is an obligation to report when we hear about a serious allegation, like a breach of, well, this is both fraud and an example of SEA. Reporting in itself is another session in itself to go through the whole reporting flow. So we won't go through that specifically here, but it's good that everyone's recognizing the obligation to report after becoming aware of this information. And then a couple other things quickly coming through. I think what's coming through here is how interconnected some of the programming really is here, as well as the fact that when we do monitoring, whether that's post-distribution monitoring or others, it can also help reveal or bring to light any misuse of funds or any issues like this. So again, it's highlighting that importance of checking in with and really listening to communities to understand what is happening in terms of program implementation. Yeah, and the importance of client feedback and of protecting the anonymity of those who give feedback. So making sure that feedback is safe and confidential. Anything else to add there quickly? I know this is an incredibly complex one as well, before we go on to the last example. Okay, so we are just scratching the surface here. I will quickly, there we go. We skipped over this by mistake. Take us to the legal protection example. Jessica T, would you like to take people through this one quickly? Another cross-cutting situation.
Sure, thank you. Okay, so we have a client who's receiving both MHPSS and legal services. They've shared with their counselor that the highest lawyer who's handling their case is not friendly and gets impatient during conversation. He says he's not comfortable telling his lawyer everything because it feels like his lawyer is not listening. What should the counselor do? Yeah, this is interesting because you get into kind of cross-team dynamics in which there may be some interpersonal dynamics, inter-office dynamics, but where centering our accountability to our clients still needs to remain central to our approach. So I'm interested in kind of thinking through the frameworks that Natalie has set up for us. How might you think about responding to this? The chat is a great place to start. Or if you in your situation, in your context, had a conflict kind of between different teams in your office, how might you think about escalating an issue? Okay, yeah, we have Emily. She said if she was the counselor, she'd write an email explaining the situation to the country director and the lawyer, asking for a meeting. Okay. Inform the client that they have the right to change their lawyer if they feel like they're not being listened to. That's great. Yeah, it's interesting. Our clients absolutely have the right to make choices about their representation. So it is true that is important information that we can give to our client about their rights and their choices. Sivan, the counselor can also speak with the lawyer to find out what might be causing the communication problems.
Emily's pointing out a potential misunderstanding between the lawyer and client as well.
Right. I think it's also important that we get the client's informed consent with how we proceed internally. For instance, they may fear retribution if they're kind of outed to their lawyer. They might want a quieter internal process. So again, kind of centering their decision making is important. It's important that they. So Alfredo, it's important that previously they know the contact to inform the situation if they're not comfortable saying to our lawyer. So that they know the channels for an appropriate complaint mechanism. That's right. There might be a more appropriate channel for a complaint mechanism, for instance, an anonymous complaint mechanism. And again, they may wish to be very quietly transitioned to another lawyer. So I think it's important to center their wishes and their decision making in how we move forward. Natalie, what would you add to how we think about kind of escalating accountability in this scenario?
Yeah, I think something, so in terms of getting into the actual process, that may look a little different depending on the structure of the CO and depending on kind of what the complaint really centers on. I think something that's coming through Alfredo's comment, and I'm seeing unspoken but implied through a lot of comments here, is also the importance of all staff understanding what to do with that feedback and being trained on where that feedback really should go. So, you know, making sure that the MHPSS counselor also understands, you know, what do I do if my client is telling me they're not comfortable with the lawyer? So it really does highlight that AAP touches, you know, all areas of programming and really all staff. As well as I think the piece about making sure that the feedback mechanisms are robust and safe and accessible and anonymous, and that they really, really reflect what clients and people who are affected are saying that they want and need. So I think that's a big piece of the takeaway here. In terms of escalation and reporting, I think that may be a follow-up that we get into at some point, because that it's really, really important, but it gets into even a whole other session. Anything else to add on that one before we do make sure we have some time to think about PSEA specifically? Okay, I'm gonna go ahead and hand it over. So just to do a quick spotlight on PSEA, handing this over to Emma and Heidi, recognizing that this is a much, much larger topic that deserves several sessions, but to quickly orient us here.
Hi, everyone. This is going to be, just to frame this a little bit, this will be a quick spotlight on P to the S to the E to the A, also known as prevention of sexual exploitation and abuse. It will be a quick spotlight because we plan on doing 1 to 2 more webinars specifically on preventing sexual exploitation and abuse. For the purposes of the 6 minutes that we have left, we are going to cover some high level, just some higher level things, and have a bit of a discussion, and really would like to hear from you when we do the specific webinars on prevention of sexual exploitation and abuse, if there is anything in particular that you want us to cover in those webinars that, based on your context, based on your experience, would be particularly helpful. So there is that. Let's start with when I say sexual exploitation and abuse. We hear about it a lot. I know that many of you have attended UNHCR-led trainings on their code of conduct, their policies related to sexual exploitation and abuse. When we say SEA, what is sexual exploitation and abuse? I'm gonna get a complex, folks. Just kidding. Any thoughts on what sexual exploitation and abuse is? Okay. Well, that's an interesting data point. So from the UN and I will go from, for the purposes of this conversation, I'll go from the UN Secretary General's bulletin, and defining sexual exploitation which is any actual or attempted abuse of a person of vulnerability, power difference, or trust for sexual purposes. And this exploitation, so you hear some keywords there. You hear power differences, you hear a person in a position of vulnerability being exploited by someone that has more power, right? And very specifically for the purposes of obtaining, getting, having sex. The bulletin goes on to say, thank you, Grace. Oh, here we go. Here we go. Thank you. Asking for sexual favors from clients so that you offer services, using one's position to ask for sexual favors, use of power and authority to demand sexual favors from beneficiaries. So a couple things here. We are talking about sexual exploitation and abuse in the frame of HIAS's programming and HIAS's work as a humanitarian actor, right? So that could be HIAS staff doing the exploiting. It could be community members that HIAS is either employing or working with as community volunteers to somehow abuse their position of power, right? Natalie, we have 2 minutes, so I'm gonna go to these are the things that we are going to discuss. And for the interest of time, there's 2 things. Can we go to the next slide?
Sure thing.
One is in this slide there is an interim technical note, right? This is a collaborative technical note from WHO, UNHCR, UNFPA, UNICEF, and I think one other organization. They have put together this technical guidance on protection from sexual exploitation and abuse during COVID-19. Okay, this speaks specifically to increased risk related to the situation of COVID-19 and makes recommendations for action. This is the first version. It came out in March. These links are for the English, French, and Spanish version. So encouraging you all to take a look at that. And if folks could just take about 15 seconds to write in the chat box what would be most helpful when we do the next webinar specifically on sexual exploitation and abuse.
Thanks, everybody. And just to say, unfortunately, I'm hopping off, so this slide may disappear as I jump off, but I know that we will send this around, and Heidi or Mulu or anyone else also has a presentation as well. So sorry, just going to another call. Thanks, everybody. I think Mulu is putting the slide up.
Thank you.
And sorry to folks that the spotlight on SEA was a tiny little spotlight, but we'll shine it brighter during the next webinar. So any and all, so I see more scenarios, using scenarios, videos or documentaries. All right. And feel free to reach out to Mulu, Natalie, myself with more specific requests for what the webinar should cover in terms of your needs at the field level. Mulu, thank you.
Well, thank you, everyone. I think this was a little bit of a kind of a sprint to go through all this major and complex topic. And as Heidi said, the PSEA really deserves a focus and a full training to everyone that needs to get the training. In fact, actually, this is literally everyone. We, as Natalie mentioned earlier on, there is a standard operating procedures that's being developed about PSEA by Office of our legal office, General Counsel, Office of General Counsel, that will be rolled out, that will guide reporting procedures. So we will be linking the AAP guidance with that policy and standard operating procedure so that everyone is clear on how these, you know, if there is an incident, how it should be investigated and really handled. I believe Laura will share the recording of these webinar, as she does for all others. So those colleagues who might have missed this webinar would have the opportunity to listen to the recording. We will have a Spanish session at 11 a.m. today. So those from the Latin America region, if there are colleagues or who would be attending and should be attending this, please encourage them to sign on at 11 o'clock and feel free to forward the invitation. Otherwise, have a good day, afternoon. Oh, thank you.